Tumambal yun. Success. Okay. Anyway, so you will start. It's okay if you will eat. So you will, I'll try to make it quick if you don't mind. So you will start with your hot packs. Basically for all modalities until the end term, the same lang siya mga pre-attacks. Kumbaga SOPs na siya. Like make sure that that is the best modality for the patient's case. Prepare the patient psychologically, meaning you're going to explain the procedure to the patient. What the patient should feel, what the patient should expect. Preparing the patient physically, meaning if there's a need for the patient to change and proper positioning and draping. Okay? So there are some instances like your ultrasound, the area needs to be exposed. The bare skin needs to be exposed because you're going to put the gel. But let's say for hot packs, there are some areas in which there's no need for the patient to undress. Okay? So that's one of its advantage. So pwede lang yung example on the shoulder. So you can keep the clothing on and then you just put the hot pack over it. Okay? Yes. Sige, so quick reviews are mentioned as Sir Z has mentioned 3 temperatures. So what's the temperature of your hydrocollator unit? Unit. Yes, 70 to 75 degrees Celsius. Please mag-rent them that even the cracks. Do not forget the unit, ha? Because we have degrees Celsius, degrees Kelvin, degrees Fahrenheit. So we're using degrees Celsius. Okay? Kung kisa di ba ga-ask ko na, what's the temperature of the ammonia? So may ma-answer lang, 70 to 75. So di ba ga-ask man ko, 70 to 75 ano? Okay? So do not forget the unit at all times. Sige, what's the temperature of the bare pack? Si bare pack. Si bare pack. The bare pack. Yes, the bare pack is the 60 to 70 degrees Celsius. Okay? And if it's already wrapped in layers of towels, so its temperature is 45 degrees Celsius because that's what the skin will allow. Okay? Sige, quick question. What's the temperature of the modality that you will be applying onto your patient? 45 degrees Celsius. If then you say modality, ang gina-apply ita, meaning it's already wrapped in layers of towels. Clear? So again, we have 3 ha. The unit, 70 to 75, the bare pack is 60 to 70, and the modality, meaning it's wrapped in layers of towels, is 45 degrees Celsius. Sige, here. For new packs, it doesn't look like this. So ang gawa niya is, do not shrink na siya. Okay, meaning wala pang absorb water si gel ta. So it's nag-shrink pa na siya. Yes. Yes, so, oh, init pa man eh. This one now. Sige, if it's brand new, for not that hot. Kikit pa tayo ito na. If it's brand new, so you're supposed to soak your packs 12 to 24 hours to absorb water. Okay? And that's why, amo na niya itsura niya na yun. It becomes chunky. Pero it's mas init siya dapat gawin. Ito 60 to 70.
Miss, the night before, miss dapat na ano na?
Hindi man, morning palagi na-on na siya. That unit is 70 to 75, that's why diba? It becomes very hot. Pero again, if it's brand new, again, we have 2 time frames here. If the pack is brand new, meaning wala pa siya na-soak, nag-shrink pa siya, you're supposed to soak it in water for 12 to 24 hours. Para nga mag-ammonia siya. Para i-absorb ni silica gel ang water. Okay? And here, if you've already used this, meaning arat na niya siya sa unit, and then, let's say, gin-wrap mo na siya, gin-apply mo na siya, ibalik mo siya. Let's say you're going to reuse it for another patient. You're only going to reheat it for 30 minutes. If the water is hot, well, technically it's always hot because the unit is on at all times. But if the water is cold, so you're supposed to heat it 2 to 3 hours to achieve again its temperature of 60 to 70 degrees. Clear? Init-init din siya.
Ibutang mo sa tanong, kailangan.
Sige, here. This is what you mean when decide whether to use towel or hot pack covers. So here sa Riverside, mostly in Bacolod and around Negros, we're using bath towels to wrap our packs. But sa Iloilo, sa Spoy, if you go to your internship there, sa St. Paul's, they use your Turkish towel. So itsura sa Turkish towel, Ang shape niya, if you're familiar with, what's that? Empanada? Empanada pastry na ba? Doon muna siya, do dumpling siya. Pero one layer. Yes, one layer lang siya yun. Naduibutan mo lang siya, and then you cover, and then that's it. And then it can keep its temperature. Okay?
Hindi man siya tamang kadamol, miss, for that pack. If ang towel na ginausar tapos.
Hindi, if okay, sa ganyan mo need more than one. Hindi init din siya yan.
Okay.
So mag-dissipate ng heat. Okay? Sige, here. So, place the towel hot pack over on the table, not on the patient. We always prepare our hot packs on another side. So usually, if our using hydrocolator unit, we are in the table where we are to prepare this one, we never prepare it on the patient or on the plate. Okay? So dapat pagka ito sa patient, prepared na siya yan. Kumbaga wrapped in layers of towels. Okay? Sige. Since it's very hot, technically, so you're supposed to remove the pack using the tongs. So kada unit na may tongs na na. But since your hot pack is one of the modalities you will be using almost every day, several times a day, if you go into your internship, you'll get used to the heat. So, especially kung gadali ka, pwede na lang you just grab them by the ears. Wala na tongs, paun mo na lang tak, and then prepare. Okay? Sige. Very important, allow excess water to drip into the unit. Once you're going to take it out of your hydrocolator unit, allow excess water to drip. Hinatak-tak na siya. Because if not, if you're going to take it out and then you're going to prepare it in the table, your towel will get soaked with water. So pag-apply mo sa patient, basa siya. Hamog siya if you apply to the patient. And the patient will be able to feel the heat na i-dissipate ni hot pack. Clear? And also very important, you close the lid once you've taken out your pack. So if it helps, you can also bring this one, mga basic na. You take it out of the pack, allow excess water to drip, put it there, close the lid to maintain the temperature of the water and the other packs inside the unit. Clear? And then you bring this over to your preparation area. Clear? During your return, there's no need for you to say this, ha? Na, miss, I will take it out, miss, I will close the lid. There's no need. Kasi if you're going to treat the patient, wala makamugaan mo na. Diba, ginahimo nyo lang yun siya. So mag-get them, just do the same. You just do it. No need na nga to narrate you what you're going to do. Okay? Sige. I will show you. I will also post a video of it. Sige, this is by the book. So some of you might have been exposed to centers or some facilities na garap sila hot packs. And if you become PT professionals one day or licensed PTs, pwede nakamuya ka change on how you're going to pack your hydrocolator packs or to what do you call this? Prepare it. Okay? Pero this one, since you're still learning, you're going to get the board exam. So we're going to stick by the book. Kasi board sensitive, di ba? So we're going to stick by the book. Sige, for those in the back, you can come over to watch.
Same thing.
Sige, again, this is by the book. So, if it's by the book, meaning this is what we will follow for RETM and grants. Sige, so assuming we have the hydrocolator unit here, I'm going to open, I'm going to get it out using the tongs technically. The excess water to drip, close, and then let's say I'm going to prepare. So there, if you have your pack, you're supposed to place it on one end of the towel at the middle. Okay? You can tuck the ears if you want, pwede siya magwa. And then you're supposed to cover it. There. Jordan. Okay, clear? Lengthwise siya over the pack. So the pack is at the center on one end. And then you're just going to roll it over lang yun.
Tapos yung ball man sa machine.
Yes. Okay. So, fold the towels over so you're able to have your hot packs. Remember, okay, it comes out in the boards. There should be 6 to 8 layers of towels. That's on each side of the pack. So how do we count the layers of towels? This is your pack. So this is 1, 2, 3, technical ko na 4, 5. That's 5. But the other side, 1, 2, 3, 4, 5 siya. We do not count this by this one, by fold. We count it by the layers. Okay? So again, that's 5 layers on each. We need 6 to 8 layers of towels. So you can get another. You can get another towel. Miss, do we wrap it the same way? Technically, no. So hindi na siya pag-i-fold just like we did sa step 1. Okay? So what you can do is, you can actually just put it over. Let's say, this is the patient. You're going to treat the low back. For example, patient is in prone. So you just put this over the back. This already 2 layers, diba? 1, 2. If I'm going to put this, 5 layers, plus 2, that's already 7. Clear? And then, you're supposed to, place another towel over the pack. Technically, you're supposed to cover. Let's say, example, kung ako ni, you're supposed to cover. This other towel will act as an insulator. Because, di ba, superficial heating siya. Eventually, in time, heat will dissipate, or in vernacular, di ba, mahulas ang heat. So, maamatama siya, lose iyang heat. So, the other towel will act as an insulator to prevent ang dasig na dissipation of the heat. Okay? So, in this case, if you already have 2 here, this is 5, that's already 7. So, you can use this one to cover. So, duwa lang siya yung towel. Clear? So, sorry. Hindi, we're counting on each side. So, 5, 6, 7. Underneath 5. So, 6, 7. Clear? Again, it's on each side. And we're counting the layers, not the folds. Okay? On each layer. So, provide the patient with a bell or any means of assistance to call you. So, technically, you can leave your patient. Okay? As long as you just check the patient from time to time. Let's say 4 to 5 minutes. Why do we need to check for 4 to 5 minutes? So, there are some cases wherein patients, they have high tolerance to heat. So, pwede nga, ang 6 to 8 layers, wala kami mabasyagan ng init. So, what are you supposed to do? Yeah, so, ibanan or you remove layers of towels. Or, let's say they are sensitive to heat. So, what will you do? You add layers of towels. That is correct. Okay, so it depends. So, 6 to 8, that's just the standard. But again, we always refer to patient's preference. Okay? Kaya kung hindi niya ma-feel ang heat, kailangan magpilito ng 6 to 8. Okay? So, let's say, after 5 minutes, hindi ko na ma-feel ang heat. Di ba? So, you just remove this one and directly apply this one. So, that's 5 layers. And then, cover. Okay? Kung, may cover, may kasi the other towel will act as an insulator para nga maglawig ang iya heat. Okay? If, kailangan pag magbuhin, so, tandaan nyo ha kung hindi ka mo nagbuhin. This is 5. So, if you're supposed, kung magbuhin ka, so same lang. So, 3 layers na lang to siya. Or technically, we don't go as far down as 3 layers. Kasi init yun siya yan. Sige. Miss, what if init siya? Let's say, 8 layers ka na, nainitan yapon si patient. So, ang ari, di ba kagina? This is already 2 layers. If you just fold it, that's already 4 layers. And then you just put this and have another towel naman. So technically here, you have 9 layers na. Okay, so again, ang wala na, kung mag-alter na sa layers of towels.
Okay na mismo mag-exceed sa 6 to 8.
Yes, okay lang mag-exceed sa 6 to 8 as long as is the patient's preference. Yes. Kung taman, kainit para siya, that's the time you add. Okay? Questions? Tapos lang siya ha, i-pack ha.
Pwede, kung mag-4 layers, is okay lang siya. Unless,
It depends.
It depends ganyan sa patient. Pero, if you're going to prepare it, dapat naka 6 to 8 layers ka ganyan. Ang initial nyo ganyan is always 6 to 8 layers.
From 6 to 8, mabuhin ka lang or
Maagbuhin ka lang or maag. Clear? Sige. I'm going to teach you, if you go to your internship sa Siliman, okay, they have this way of wrapping their pack. Sige, advantage of this, if you're going to put it, ang gihimot, tabi lang by the book sa the end, at all sides, hindi madagdag. Kaya siya yung sa tunga. Clear? Sige. Compare mo if undeniable, especially if you're, I'm not saying I'm doing it. Never pa man ko tinamaran ever since. So may iba, let's say, kung gadali ka, so pwede lang yun you just do this, wrap. O, di ba? Mas lasig siya.
Pero miss, hindi ka.
Okay, yeah, so ako lang nagaling, kasi di ba, hindi siya secure. So pwede siya madagdag. Clear? If you have time, so you just do the proper way na lang ito doing it. Okay? Sige. So here, ang sa...
Ay, kamo, cute.
Sige lang kung I will be posting man video. Sorry. French.
Ay, naging video ang tago.
Okay.
Ito pa ngayon, so that means
dapat naka-prepare. Sige, so this is as per Siliman.
Kaya ko sila miss kaya
Yeah.
Kaya mo naglinga plus.
Hindi ba? Sige. So this is Siliman's way if you go to your internship there. So you have 2 towels, you fold them lengthwise and half, and then you do this one. So may ara ka sa at the edge. You put the pack there, and then you this one. Lagi na alternate lang siya. Draw them. No, kaya ginamit ito by the book. Okay, as per Siliman. Yes. Pila ka degrees? It depends. Kasi di ba we have first degree burn, just like your sunburn. So, depende kasi. Sige, so if we have the pack here, so we have 1, 2, 3, 4, 5, 6, 7, 8. 8 layers na siya yan on this side. So, muna din siyang ibutang sa kay presents. And then you have another towel to cover it. Kaso, ang mga na, ang para sila is, if you're going to remove layers of towels, so, amon-amon mo lang na siya. There. And then, if you're going to remove again, remove, and amon naman na. Clear? But again, this is, as per Siliman, what we're going to follow is, ang aton din, ang by the book. I'm doing here. Wait, done ka na ba? Okay, questions with your hot packs? None? Clear? Sige, I will continue ha, if wala questions. Basta wala na questions, mag-read them next week ha.
Ayun, boy. Basta hindi lang number 1.
Oh, yours is randomized. It's always randomized.
paano niyo may kina-randomize?
Randomizer.
Miss?
Ay, no, sorry.
Ulitin ko number 1. Ulit, na miss. Wait, kung ako matatawa, miss. Miss, wait ko. Kulot, miss yan. Puro yan sa kasi siya. Kisa mag-random ko.
You're familiar with that, diba? As a randomizer na pala. And then you just put the list of all the students and then it randomizes the list.
Wait, ako, remember, sa top 10.
Miss, mag-random ko, miss, in gender. Asa to, bang kumabsent o sa likod kumabsent? Ay, yagay.
Pwede ka sila lang dito.
And then, sige, next. So this is your cervical type of your hot pack. Yung cervical is very easy lang. So it's still the same. Just put it on one end. And then, standard. So, i-muna mo lagi na siya yan.
Ang sa side bed, miss, pa.
Wala na. Wala na lang na.
6 to 8 tayo.
Miss ko nga mo na yung count mo gid ni as one na layer.
Ang alibigit dito half siya, so we count the other side here. So if we have the pack there, so this is 1, 2, 3 lang. 3 layers. You draw this. Sige, if you need another towel, miss, start na naman siya again. Technically, there's no need. So again, pwede na lang hanggang mo na lang dito. So this is already 1, 2, 3, 4, 5, 6. 6 plus 3, that's already 9. 9. And then you have another towel to cover.
Hindi ko lipanan mo, miss.
Pagkabanan mo. Siya, sige. I-open mo.
Ano mo na na?
Yes. Ang important lang it is the number of layers of towels and there should be another layer of towel covering your back at all times. Okay, if you're going to do this again na naman, kanina mo naman na siya, damul-damo, mo pa. And damul-damo, ka makonsume na towels. Okay?
Miss.
Yes.
Okay, miss, kami na pala. Paano lang? Or miss,
Ang bunig.
Ito, miss, kami.
Ang by the book, yeah, kasi you're still students, iba ko ako board, so ako nagagawa sa PT apps. Sige, questions with your standard and your cervical. None? So far, none? Okay. Sige, total treatment time is 20 minutes. After 20 minutes, so you suspect the area to be treated. Again, if you're using hot packs, it's normal that the area is red and warm to touch. Okay? Same lang. Sige. Ay, hindi. Total treatment time na. Dala na siya. Dala ba? Sige, dosage within the patient's comfort, meaning as long as the patient deems it beneficial, so pwede mo siya magamit for years, maintenance if you want. Pero when you say length of application, that's per treatment. So it's 20 to 25 minutes. 20 minutes is enough. Okay? Frequency, you can use it twice or thrice daily, but with an interval of 3 to 4 hours. Okay? Hindi pwede nga after an hour, apply kaliwat. Okay? Because that area has already been exposed na siya sa heat, meaning vasodilated na the mga blood vessels. If you're going to apply less than 3 to 4 hours, the area or the skin won't be able to adapt with the heat. So you're prone for having burns. Okay? Duration varies depending on phase of injury or desired effects. Again, if gusto niya yung maintenance, let's say ang goal is for relaxation, so pwede magamit niya every day for the rest of his or her life. Okay? Sige, post of task, patient's instructions. Sige, very important. Once you've applied your superficial thermotherapy, always tell your patient, ma'am, sir, if you want to continue that at home, so at least, di ba, after 3 to 4 hours. If wala ka any type of hot moist pack, let's say, di ba, mga ointments or the mga balagyos, which could generate heat, still the same. You can only apply it after 3 to 4 hours. So, very important na siya ha, on this one. Kaya basing, kung di ka mo nakatag patient instructions, after nag-treatment, nagwa na si patient, nagambal siya nga, doon kakapoy. Tapos naman use siya, like mga Pauli-Arco or mga Omega. Okay? So, it's not yet 3 to 4 hours. So, mas dasiga init ang ina area. Okay? Record your treatments. You already know your SOEP. So, what type of pack you use? Is it the standard or the cervical? Patient's position, the area treated, and then the patient's response. The usual. Okay? Equipment replacement and clean up. Sige, so once you're done, always put back your packs in your hydrocollator unit and hang your towels to dry. There are some centers nga damo sila budget. Okay? So, once lang ang use ng towel, you discard it for laundry. Pero there are others nga the area is clean naman. So, you can reuse the towels. So, if that is the case, you hang them to dry para pwede siya ma-reuse again. Okay? Sige. For equipment clean-up, we're talking about your hydrocollator unit. So, you're supposed to clean the unit at least once a month. So, let's say matiming, bingo ka muna tuon pag-internship niyo. So, dapat kabalo ka muna how to clean it. So, your hydrocollator unit, di ba mayroon siya racks inside? Yung pakita ni Sir Z. I'll show you later, quick lang sa PTC. You're supposed to take out the racks, take out the packs. You drain the water, clean the inside of the hydrocollator unit. And then, you replace the water. And then you put back your racks and your packs. Clear? Very helpful stuff. Sige. Here, kindly take note, it comes out in the board exam PDFs. You keep the water level above the top of the packs, meaning your packs should always be submerged in water. Okay? So, if, there, pagkita mo is, sorry, diba they're actually standing, or it's easier to take them out. Hindi siya nakaabuni guys ha. Dapat visible ang ears ni Bala or ang mga hooks niya. So it's easy to clip them or to tong them out or to take them out. Hindi nakaabuni. Clear? Sige. So if nakita nyo, inside, pag open nyo, the water is here. Okay? You're not supposed to add water. Ay, jutay na hindi siya na-submerge. Because if you're going to add water at that instant, you will change the temperature of the unit. So meaning, hindi na siya maka-achieve 60 to 70. Mahulat ka na naman pila ka hours or minutes. Meaning, if you're going to add water, you add it at the end of the day, meaning wala na may magamit. Okay, meaning buwas na naman. So may unknown mo siya. What we usually do is, medyo push na siya jutay para ma-completely cover lang yun siya. Okay? Sige. Do not allow your packs to dry out. That's why you always keep them inside. You've seen, I'm assuming, naka-play, nakapunta ng clay, mga play-doh, never, or you're trying to touch, or naka-try ka mo touch, or mud na lang, di ba? Ang mud, if basa pa siya, is you can try to hold it. Pero when it becomes dry, di ba, it becomes brittle, gabuka-buka siya, gabra. Okay? So that's what will happen also. So this one, ang canvas, and then pwede siya ma-break ang imo nga silica gel inside. I do not want that. Okay? And hindi na siya magamit. Okay, so we have different sizes. That one is your cervical. Again, cervical, gusto yung this one. And then we have the standard size. Very seldom that you can see the half size for distal joints. Let's say the wrist, the ankle. Sorry.
Tula.
Alam mo man ang pinaka-usual.
Yes. Ang sa knee shoulder, ilan na mo na? Ang sa knee, balang sa knee shoulder.
Ang sa knee ko shoulder because they are bigger. So usually, di ba, if this is the entire towel, isa na siya ka-cover.
No.
And then you just add layers of towels.
Asa mo?
Ang sa oversize naman niya, so isa lang siya, butang mo ng oversize, tabunan mo siya isa
Paano
ka-towels.
yung ang buho? Sa knee?
No, ang buo is hindi man siya
Para na sa patella, bro.
Para na siya for the cutout, siya for the patella and here, ang sa acromial area. So matabunan din siya eventually. Kaso wala lang siya kumbaga ang gel to put pressure on that area. Yes. Ang half size, technically, for distal areas, like ang wrist, mga ankle, or sa mga hands and the foot.
Ay, wait.
Ay, go.
Grabe naman ang...
Prepara ka na mo. Prepara ka na.
Or something naman, different din siya.
Alam mo na.
Or we do not
Kasi
we will not dwell on the
Tuloy kasi kayo sa
dimensions.
Brazil.
At least aware lang ka
May
mo.
15 na
Okay?
before.
Sige. But again, as I mentioned, the very common ones, your cervical and your standard. So that's why, hold on pictures na. You can use the cervical there. Siya gonna use na for this stuff. Siya gonna use na for the wrist. Siya gonna use na for the elbow. Matiun ka po.
Ay, okay.
Siya gonna use na for the ankle. Siya gonna use na over the elbow. You can also use it along the length of the lower extremity or along the knee. Clear? Okay. But technically, again, it's for the cervical area. Clear?
Sinibero.
Ay, sorry, camera.
Okay. That one, the standard, usually for back areas or for bigger muscle groups. Let's say anterior thigh, posterior thigh, or say quads, or say hams. Okay? Okay, good question. On that picture, correct na siya ang application. Miss B.
Pwede to.
Yes.
Why not ko?
Correct. So, wala another towel to cover to act as an insulator. So, dapat may arm din. Clear?
Amo tong arm.
Sige, Ara, wala mo siya sa cover. So, dapat si Ara, get per main cover. Si Miss Bea.
Ayun,
Ay,
So again, you can also use again sa standard for bigger muscle groups. Miss Bea, our program head. I don't know Miss Bea.
Pwede ba? Round nag-scam sa mga kapiti.
Sige, any questions with your head packs? None?
Ay, kung mga kapiti, wag na rin sila.
None, I will proceed. So meaning, mag-ret them ta, either like the standard or cervical ang gamiton nyo. And then, syempre, it makes sense man, if you're going to treat the wrist, malamang the cervical one. Okay? So,
Miss Woodline.
word of advice lang, hindi siya would like, kasi di ba ganun, ang problem nyo is wala kang nag-review anatomy. Anatomy is our bread and butter, supposedly. So, doon mo ng basic na gid. Okay? Oh, so, meaning the next week, review your anatomy gid. Okay, para correct that area. Oh, another pa gid. Ang damo man, ang sala, ang laterality. So always check ha, it's the patient's laterality, not yours sa right and left.
what if Miss Gay, check kita muna ang good side. Ang good side, o negative side, and then ang bad side.
Pwede you can cheat the good side.
Ang mga song.
Okay lang na yung for ROM. Pwede kaya humble nga nag-assess ka na isang good side before you assess the other side. But since we're dealing with modalities, hindi pwede nga in-treat ko lang yung good side, tapos i-treat yung bad side. Di ba? So hindi siya pwede.
Ay, sorry. Gusto ko lang makipay. Sabi isa ka.
Yeah, another pag-it is, na-notice ko, some of you tend to overthink or overanalyze.
Ayun, doy.
Eh, like me, na ito mag-given, nagidya nga, amo lang yung i-cheat mo, amo lang ng goal mo.
Sorry.
Pero nagsala ka pa area, maging cheat kayo, tumaging lain pag inimbo, in-analyze. Okay? Wala ko pala naman.
Ikaw ito yung sak.
Isa ito, some areas. Akong dito. Wow! Yan yakon yun. May bele, pasok natin.
Hindi, mas yung
Kung ako damay sa
Sige, no questions yung backpass. I will proceed ha. Okay. Sige, next we have your IR labs. Quick review. So, di ba we have 3 bands? IR A, B, and C. Which band do we use for the rehab setting? IR A, which has a wavelength of
700 to 1.5. Vlog pa ito, boy.
yeah, 770 to 14 nanometers. Pero in general, so it's 770 to 10 to the 6
Kaya mo naman tayo
nanometers.
confident ka para agree na sa musika.
Sige, so again, your infrared comes in different types. So you can have this, ang horizontal lang or the small one. Usually, hindi siya very adjustable. Very limited lang ang either. You can adjust it ng jutay, ng tanga, or doko. But if you want that to one, okay, let's say the patient is in supine or prone or side lining, so you can have the vertical lamp. Clear? So again, we're using IRA, wavelength of 770 to 14 nanometers. Okay? Because the skin will only allow until 1200 nanometers lang. Okay, for the absorption. Sige. Again, still the same SOPs. Make sure it's the best modality. Prepare your patient psychologically, explain the procedure. Prepare your patient physically, meaning proper positioning and draping for the patient. Sige, here lang. Since we're dealing with your IR lamps, so if there are any jewelries, it's best to remove them because they will easily heat up. Okay? So, if you are to be with the patient the entire time, you yourself should also wear your IR opaque goggles. Sadly, here sa Bacolod, wala ba tabiga use, get your IR opaque goggles, even for your patients. But then again, technically dapat di siya. So these are not just goggles or during the pandemic, ang mga protective goggles. So they are specific opaque goggles. Clear? So they can deflect or do not absorb your radiation.
Machines ko yun.
Sige, here. for about 5 to 10 minutes first for it to achieve its stable output na 770 to 1.4 nanometers. If we're going to do that, please make sure you do not direct it out in the open. Nga pwede, bala makalabay-labay. Okay? So either we direct it on the wall or something solid. If, let's say, busy kita entire rehab, so if already ka sa cliff, ipa-face mo siya sa curtain. Okay? Basta make sure ang curtain is hindi siya balang maglusot sa curtain. Okay? Again, something solid before you use it. Like it achieve its stable output. Sige there. So we have specifics onto that one. So there has to be specific distance between the lab and the area to be treated. So that's 45 to 60 centimeters or 16 to 24 inches. That's approximately 2 rulers. You don't need a tape measure. Dapat measure nyo yun ha. Pwede nyo lang like this one, that's already 1 ruler. So 12, 2 sila, 24 inches. So pwede nyo lagi siya yung ma-estimate here as long as you stick to that one. Meaning, not too near, not too far also. If it's too near, papasyagan din ni patient na init siya. If it's too far, so hindi less ang heat na ma-feel niya. And, miss para sa diinin ng muli. Technically, your IR labs, wala din sa liya muli. Ang RE, ang dupa telescope, the folder. Okay? So, ginagamit lang siya this one kay para nga ma-try to concentrate or ma-focus sa inyong lab. Okay? Iya nga radiation. Okay, if not, di ba, which is one of its disadvantage, hindi siya localized. It can have a wide scope. Okay, very wide. Di ba? Especially if you try to move it farther away, mas bigger ang iya nga scope. Okay? So again, you can leave the patient, just like your hot packs, give them proper instructions, and do not move, avoid moving. Very important, especially for IR, hindi mag-move si patient. Because the moment mag-move siya, or mag-move mo ang lab, di ba, ganain ang direction niya, ang iyang localization. Clear? So set the lab, general is 15 to 30 minutes, but you can specify that one. 15 minutes or the lesser time for subacute conditions. For chronic conditions, so longer time. Para mas lawig ang iya nga heating pa rin. Okay? So most labs have a timer that will automatically shut off. But this type of lamp, wala siya. Manual siya. So you will manually time. Okay? Ang iya nga duration. So once done, 15 or 30 minutes, so you turn off your lamp on this one. Okay? Do not try to play with your IR lamp. Sige, anybody here who is pregnant? Maybe pregnant? Maybe.
Miss Jess.
Yes.
Guys,
Sige. You can try to touch, guys. So, at sa kadali lang, mainit ka siya yan. Uy, exhaust. I-on.
Pag mo nilagyan pa rin.
Basta
Okay,
mag-init pa
turn
rin.
off the lamp when the intervention is complete. And since it will give off heat, again, it's normal that the area is warm and red to touch, or there could be perspiration in the area. Okay? So part of your aftercare, try to wipe off lamp if there's any perspiration. Okay?
Ikaw, puno sa misto ka, color red sa misto. Color red.
Tapos ba kasi month ka number 7?
Still the same post at task taha. Again, you could use it twice or thrice a day, at least 4 hours interval. And you do your proper documentation. For documentation galing, specify lang that distance. Okay? Why? Kaya para next treatment, ang co-intern mo will follow the same distance. So, hindi pwede yung ako lain-lain, kung may lain-lain ang distance nyo. You have to be consistent, okay, with the same patient. Clear?
Sige, miss. Talaga, miss.
Sige, check your equipment regularly. Sorry. Make sure nga walang crack. Glass na siya blandiri. Ang sa eye nila sa IR lab, that's glass. Okay? So, we usually use a brush or a cloth to wipe off any dust. Make sure you do not drop it. Hindi mabuka siya. Okay?
Mahal mo ni miss.
IR lang. Hindi mo.
Bakal ka.
Bay, hindi ka mag-usap.
No, perpendicular siya. Sige, again! Sorry. It should be perpendicular, hindi pwedeng sa babi. Patient has Bell palsy, you're going to treat the face. If parallel, di ko parallel, anong gina-treat niya? Diba? This is parallel. So dapat, diba, perpendicular, meaning across. Dili siya gatubang. Okay? Sige, here the nerve setting. Yes, for Bell's palsy, diba, that's paralysis of one side of the face, affectation of your facial nerve. We don't use your...
Uy, dito sa baba, doon si Nico. Doon si Nico.
Sige, again, as mentioned, we do not usually use IR opaque goggles. What we usually use is, we take pieces of cotton, we form it into a circle, you try to wet it with water. And then, muna na siya ma-serve as your eye patch. Just like that one. Kung diin ang affected side. Okay? And then the other side, or the good side, you just cover it with a piece of cloth, or a piece of towel, or a sheet. Pwede na siya, mga bed sheet or flat sheet. Basta hindi lang to cover the good side. So, nga exposed lang is the affected side, but you cover, okay, with your wet cotton, ang eye area. So, again, remove all jewelries, especially earrings and mga necklace. You can even cover siya. Clear? Sige. We won't have read them with IR because it's very easy. Wala. Imagine.
Miss, masitira pala kami pakawala sa live, Miss.
Dapat natin rin tayo good life.
Sige, pwede ba? Di ba makeup class? Ma-makeup class tayo for extra rhythm.
Ay, no. Sige na lang ako makita. Hindi mo dugang.
Oo, nagising nyo.
Kasi pala na pakawala, kami na yan. Nakapansin ba?
Sige, questions with your IR lab. Bashig lang yan eh.
Why na tama si Miss?